This is One on One. Back again by popular demand, our good friend Angelo Valente, Executive Director, Partnership for Drug-Free New Jersey. Good to see you, buddy.
Good to see you, Steve.
Let's get right into this. You have a series of town halls. They're called Knockout.
Opiate abuse town hall meetings.
Together with the folks at Horizon Foundation for New Jersey?
Yes, and they've been very successful. Over the last year, the Horizon Foundation for New Jersey and the partnership have teamed up, and we've had a series of town halls where we brought together local experts, folks from each of the counties in New Jersey, ranging from prosecutors to medical professionals, people in law enforcement, people in treatment and prevention. And what we did is we gave folks throughout the state an opportunity to come to understand how this issue affects them locally, and also what resources are available. One of the things we found was that there were many people that came to the meetings. We had about 14,000 that participated throughout the state. And what we realized is that there were a lot of people that didn't know the resources that were available right in their backyard. So that was really an important part of it. But also, Steve, what was really crucial was highlighting some of the best practices, looking at—
Such as? Break it
well,
down.
give you an example. We have local law enforcement—
Put up the website, team. I know you always are ahead of me on this, as to where folks can get more information on it.
We have local law enforcement offices in the state where if a person wants to go and voluntarily turn over all of their drugs, they can get treatment. That's something that's very unique in New Jersey. We have programs like a van that goes around to shopping centers and provides information to residents throughout the state. We have programs like recovery coaches, where if a person has experienced an overdose and they wind up in an emergency room, there's a person there who's been through that experience and is there to help that person get into treatment. And those are the kind of programs that we wanted to highlight and share, so those programs are then replicated throughout the state.
What about parents? There's a whole initiative that, is it fifth grade?
The fifth grade parent alert is one of the programs that the partnership has, which directly addresses the role of parents. And we know that the role of parents is crucial, especially when it comes to the opiate epidemic. One of the programs we've been dealing with through the fifth grade parent alert and other—
Well, why fifth grade?
Well, fifth grade is crucial because of the fact that many of these young people are going to be entering into the middle school or into high school levels, so they're going to be approached for the first time. That's what the research shows, to experiment. And they have to understand that there's alternatives, that it's a very positive way to be able to reject these offers, and they have to know that their family is a place where they can go to and share those experiences with, and they can be resources for them.
The foundation, Horizon Foundation, involved in that as well.
They are. The Horizon Foundation for New Jersey has been a big advocate of informing parents, and through this initiative and through other initiatives, we have been able to really make the opiate epidemic an epidemic that people are aware of, and people are now knowledgeable, and families are now asking, when they're in a situation where an opiate is being prescribed, asking whether or not it's necessary. One of the things we found in the state of New Jersey is that we have been way ahead of the curve when it comes to dealing with this issue. The legislature, through the support of many, including the Partnership for Drug-Free New Jersey, introduced a series of bills about a year ago that have really been trailblazing and have been replicated now throughout the country. One of the bills, which I know we spoke about at length, is the bill called the Notification Bill. And what that did is it provided the opportunity for a practitioner, a doctor, a dentist, or nurse practitioner, to share with the patient before they prescribe an opiate, that there may be some alternatives available, non-opiate alternatives, and that if they're going to be prescribed an opiate, to be aware of the signs and symptoms of addiction. And that bill is crucial because it's a game changer.
By the way, Horizon, not just a supporter of public broadcasting, as well as the work that we do. Just want to disclose that. The Do No Harm initiative, real quick, 30 seconds on that.
Yeah, Do No Harm was an opportunity for us to educate the medical community. And we know that the medical community is a very important player if we're going to reverse the epidemic. And we have, over the last 5 years, and we've been doing this way before it became a national mantra, over the last 5 years, we've had over 5,000 physicians, dentists, nurse practitioners participate in one of our medical education programs.
Are they more involved?
They definitely are, Steve.
Because originally there was some resistance.
Well, there's still some resistance.
There is.
There still exists some resistance. But I think that what we're learning is that I think through education, through providing the best practices.
But sorry, Angelo, isn't it a statistic that the high number, I heard the number 90% of physicians are starting to change their prescription?
Yes, that's actually one of our numbers from our research.
Whether treating pain or whatever it is.
About 90% of the people who participate in one of our Do No Harm symposiums, doctors and dentists, they have indicated through research that they're going to change their prescribing practices. And what we're learning is that a lot of this is very consistent with what the CDC is now describing, and also the Surgeon General, Center for Disease Control.
Surgeon General as well.
That's right. Both of those groups and those, what we've learned from research and from Washington is that we need to look at alternatives to opiates as a way to be able to.
Folks at St. Joseph's Health are involved in this as well. The ALTO program, right?
Their ALTO program is now a national model.
Yes, it sure is. Senator Booker, Senator Menendez, members of Congressman Pascrell.
Exactly.
They're trying to move that nationally to be a national model.
They just did recently, actually. They passed that in Congress, which is such a great sign for the rest of the country to look at New Jersey and see what we're doing.
Joe, every time you come together with us, we learn something new. This is not a one-off. This is not a singular conversation. We need to keep the fight up when it comes to this scourge of opioid abuse.
But we are making progress, Steve, and there's a lot of hope out there, and I think New Jersey is really taking a leadership role, and we have to continue to do that.
Thanks, Angelo.
Thank you.
Check you out next time on One-on-One. Thanks. Thanks, buddy.
Thank you. Great.
That was great.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by RWJ Barnabas Health, Horizon Blue Cross Blue Shield of New Jersey, the Healthcare Foundation of New Jersey, PSE&G, the Fidelco Group, NJ Best, and by Adler Aphasia Center. Promotional support provided by NJ.com. Small news, big news, true Jersey. And by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.